So I'm responding to David Clancy from Ireland, and based on what I was able to gain from his video was basically encouraging and educating athletic trainers on defining ourselves better within a globalization aspect. I just feel like we as athletic trainers know who we are, what we do, but I feel like the marketing aspect of who we are and what we do can kind of get a little bit confusing, especially for people that are across the pond and they're considered physiotherapists. I feel like when we say we're an athletic trainer, maybe that just doesn't spark up the idea of, oh, this is who an athletic trainer is. So from his video, what I was able to gain was he really was making us aware that we should start to define ourselves a lot more and a lot better. That's what I got from the video. He said that he's had some interaction with athletic trainers and really had some great points that he touched on as far as like initial care, emergency care, being on the sidelines and working with the athlete. But he also encouraged for the athletic training profession overall to better define itself on a globalization aspect. And I feel there's some ways we are doing a good job at that. In some countries, but in other ways, I also feel like we're kind of lacking some of that. So I feel like in Ireland, on a clinical role, it would be a great opportunity for athletic trainers to work hand in hand with a physiotherapist and be able to understand their role as a physiotherapist and how we not necessarily are different, but the gaps that we can fill in to provide better care for the patient, for the client, for the athlete, whoever it is that we're going to be serving. So in his type of role, I definitely feel like we could learn a lot from David Clancy and being able to see what he does and how he helps his patients, but also kind of see and decide and learn how we as athletic trainers can also, again, fill in those gaps that could potentially be filled in to improve the healthcare of what we're providing, what they're providing there as well. I mean, I've never been to Ireland, so I'm not entirely sure. I don't imagine that it'd be drastically different, but I think it's also really great to kind of get a different perspective, especially us being from the United States, us being from a different country, to be able to chime in and just that cultural aspect, how they communicate, how they run through their rehab processes, how they encourage, how they perceive their pain, things like that. I just feel like it'd be a really great opportunity for an athletic trainer to work hand in hand, again, with the physiotherapist, and see both professions just kind of grow, thrive, and see how we could work together. So again, clinical role on that aspect. That's basically it for me.